is Vetri Tilagam. I'm one of the registered nurses in this hospital. How may I address you?
A very good morning, Nurse Vetri Tilagam. Good to know that you are going to attend me this morning. My name is Sarah. I'm 26 years old. But I'm little embarrassed to speak about my situation. Obviously, you might be knowing the reason for what I've got admitted, and it is the main reason is I suffer from a kind of a problem. I don't know how to express it to you. This pilonidal sinus or cyst, as you call. I really wonder how do I got this problem? What is the remedy? How could I overcome it? It is really a disappointing experience that I have. It is giving a traumatic experience. I feel nervous, to go to my workplace or get exposed myself to any of my colleagues or known people. It is stopping my normal life. So let me know, Vetri Tilagam, what is this pilonidal cyst and how to overcome it.
Okay, Sarah. Let me explain you about this one. And before this problem, what you're experiencing now, I can really understand that it is very embarrassing situation that you're going on. Okay, before we go more detail, could you please tell me, do you have any pain at the moment?
Obviously, I have some kind of pricking sensation, and it is quite nagging, which is not allowing me to concentrate in any of my works. Especially, I'm unable to sit. Because my job is, it is a desk work. I have to sit 7 to 8 hours in front of the system. I'm just working in IT, right? So sitting is something very difficult. I'm unable to sit even for 10 minutes continuously. That's the reason my doctor recommended for this excision. So I want to know why this pilonidal cyst. How do I got it? I really wonder, and what can I do to overcome it?
All right, Sarah, let me explain to you what's causing you this problem. And it's good to know that you're in the IT profession, and that we have mentioned that you need to work long hours in a desk, and then you have to spend a lot of hours by sitting position. Okay, let me tell you before. For clear understanding for the incision that why you're going through now. The pilonidal sinus cyst, it's a small opening cyst that it's causing the surface of the skin, and ingrowth hair, and then long sitting in a same position, and it can sometimes it switch and makes skin irritation. So due to that, it can happen. So nothing to worry. We going to doctor will explain to you what he is going to do clearly, and they go to do small incision, and you can get clear with that. You'll be get rid of that. It's mainly, as you mentioned, that you've been sitting long position and spend long hours in a chair. That could be also one of the reasons, the main reason that we have that cyst in that particular place. Are you following me, Sarah?
Yeah, I could follow you, but my concern is, this is my job because 2 years ago I've joined this particular job. Another 5-10 years, I could be continuing the same job. So I have to sit for long hours. So what do you come to say even after excision? Do I get this kind of problem again and again? And probably you have not told what is the main reason. Because of sitting, I'm getting means everyone in my workplace, almost 2,000 workers, employees are there. Everyone sit and does the work, right? So in such a way that how could you say that only I've got this problem? Moreover, this pilonidal cyst is something it was told that because of non-cleanliness. But I really want to. I'm a person who take bath twice a day, always wear neat and clean clothes. I keep my surrounding neat, and that is my embarrassment. I'm unable to speak about this problem to anybody.
I understand clearly your state of mind, Sarah, but unfortunately, sometimes it happened for not only for long sittings, that due to sweatings, that cause also that mainly problems, the ingrowth, hair growth that we don't notice that in our initial state, and get more skin irritations also could make it in that way. Could you please tell me that do you have this problem before, or this is the first time you experience it?
This is my first time experience, and probably 2 weeks ago I started to have this, and I thought it could be all right. It is some kind of heat or boil that I've got due to body heat temperature. But it is persisting, and I could not tolerate the pain. That's the reason I visited the doctor, and now I'm told that incision has been to be done. But you have not told anything. What is the procedure? What all the do's and don'ts, and how I have to manage? You have not explained, I think.
Certainly, sir. I will explain to you. So our doctor will come and examine, and he is going to take you for the excision. That's a small excision you will be going through. And before that, we will be giving you medication, and doctor will explain to you what going to for the procedure. It's a small procedure. It will take 30 to 45 minutes, and after that, you will be in the recovery room for the further observation. Post-operatively, doctor will be prescribing pain medications to manage your pain, and after that, you can continue your care, like monitoring your bleeding, and if it is any signs of infection, you can also monitor your wound. It's get any wounds or any starting bleeding or infected anything, then you can contact the doctor. And also you have to take the medications as prescribed by the doctor in order to control your pains as well. And you can use antiseptic dressings.
Thank you so
Also,
much, Betty Tilakam. You have crossed more than 7 minutes, and it's going to be 7 minutes of speech, and we'll conclude the speech. Thank you.